It may be obvious, but what are some of the more common pediatric burn traumas that you see from mild to severe?
Yeah, for mild, we see a lot of toddlers like burning their hands from the treadmill or the soles of their feet all the way
You
up.
said from the treadmill?
Yeah, from the treadmill, we get a lot of hand burns from the treadmill. A parent will be
Like
like
what
running
mom
on the
and dad are
treadmill.
running? And
Yeah, exactly.
oh,
Yeah, they're so like the parent will be running on the treadmill, and then the little toddler who's able to walk independently and move around is sneaks up behind and wants to see what their dad or mom are running on and will put their hand on.
that segues to another question I was going to ask about prevention. I have a couple of treadmills.
Oh, yeah, we tell parents to put gates around the treadmill, especially if they're in use and you're using it, or to keep the toddler preoccupied with another parent in the house or another sibling that's older than 10 that could watch the toddler. And then when you're not using it, keeping the gate around it as well to prevent any usage of it.
In various emergency departments, like I said, I'm a local travel nurse. They made me the pediatric nurse for the day. And I'll never forget one kid, about a 4-year-old girl. I guess mom had a cup of tea on the counter and it was hot and she pulled the cup toward her. And luckily the burn was like between her nipples. It wasn't anything that wouldn't heal and required plastics, but I'll never forget that. What have you seen that is so preventable that parents can start doing today?
That's such a common burn that we see. I'd say probably 80% of our burns are from that age range of kids wondering what their parents are doing and pulling it down off the counter. We tell parents to keep the handles of the pots away from like the edge of the stove and putting them to the side of the handle so that if you do have a toddler that's curious walking around, that they're not going to just pull down on it right away. They can't really reach it. The other way that I'd say is keep your kid out of the kitchen. I know it's really difficult because they want to see what mom and dad are doing.
The open concept houses,
Exactly. Exactly. So it's
so like the
really
living room and the kitchen are the same room.
correct. So that's entirely difficult. I've noticed that a lot of parents are using this kitchen helper stool and basically putting their toddlers in this. It's like a long stool that they used for a
It's
gate.
like a box, right?
Yeah, and it helps,
Yeah.
conceal them in this one location while they can also help mom and dad out in the kitchen or in other places where it might be a little dangerous, but they can keep them confined in that one seal and also be a part of the experience. Is
So
what
I'm going to ask you, how close is too close to the stove? You're just don't even have them in the kitchen.
Yeah, I'd say less than a foot or 2 away is still too close. A lot of parents like to keep their kids to the side of them, which is fine too. I'd say if you're working like actively on the stove or the grill, I'd say keep them more than a foot away for sure. But they can still be entertained by asking them to look at the tomatoes or handing you things and being a part of the experience.
If bowling on the treadmill, I just never thought you would say something like that. That's interesting.
Yeah, the toddlers, you won't even know it either. You'll be running on it, and the 2-year-old or 3-year-old will come up and just want to touch the bottom of it. And then, boom, you have a burn right there.
What other mild injuries have you seen?
We see a lot of foreign bodies. Kids love to put things in their mouth, especially toddlers and at that range. A lot of batteries, coins. We see a lot of those. Those come in too, along with our smaller burns. The burns happen in a range of age. So like a toddler burn will be different than like a school age burn
How
or a
so?
teenage burn. A lot of teenagers and a lot of like 12-year-olds like to watch TV and they'll sit on the couch with their hot noodles or their soup.
Oh, I see.
And all of a sudden they move one way and it goes into their lap. So you see a lot of thigh
Okay, lower
burns.
body. The toddlers, I would imagine, they're just touching everything.
Touching everything. A lot of the face, neck, chest is a lot of the burns that we see in that age range. And then as you move up in age, you're doing different activities. So the lap with the soup, sitting on the couch, watching TV or a movie is a common one for a teenager, for sure.
This is a tough one to separate from, even as a medical professional, because it's children. It's always the thing that gets me whenever I see these patients.